are concerns about people misusing common allergy medications like Benadryl.
Yeah, some doctors say there are better alternatives with fewer side effects. Joining us now is Dr. Robert Naclerio from Johns Hopkins University School of Medicine. He co-wrote a review calling for the removal of diphenhydramine from store shelves. Dr. Naclerio, thank you so much for joining us this morning.
My pleasure.
Okay, so everyone understands diphenhydramine is the active ingredient in Benadryl, such a common medication. Talk about this review and why it's being called outdated. We wanted to have you on because I'm a person who doctors have told me before to take it for sleep aid. I have a mom who has severe allergies. She takes 1 million Benadryl a day to prevent those food allergies, and a lot of people use it for those reasons.
Correct. So probably the best place to begin with is that to say that histamine is a chemical that's secreted in the body during allergic reactions, and the most common of which is allergic rhinitis from that. But histamine also plays a role in many other functions in the human body from that. And in 1946, Benadryl or diphenhydramine became approved by the FDA for the treatment of allergic rhinitis. This was a major breakthrough for millions and millions of sufferers. But, you know, drugs have a lifespan, and what happens is they become very useful, side effects become known, and then for the companies and pharmaceutical industry comes and develops newer molecules to try to make it so that the beneficial effects remain, but the harmful effects are decreased. And that often people refer to as like a risk-benefit ratio. And that has happened. And so diphenhydramine or Benadryl has really gone through a number of this kind of life cycle. It's dropped in its intensity, its usefulness, and it's still very effective as an antihistamine, but its side effects have really grown. Our review was more like an editorial where we were offering opinions, which is to say that, you know, Benadryl has these known side effects. To society, it's costing millions and millions of dollars to treat these side effects, and we have good alternatives.
Well, Dr. Naclerio, you just touched on it. The side effects, what are they? And I think a lot of people want to know, are there any risks?
Well, yes. So side effects are kind of divided into sort of 4 big categories. The first is sedation. People become sleepy, drowsy from that. This can be particularly bad in older people where you have the problem of falls from that. And then there's even some data now that these can lead to, in effect, dementia, the rate of development of dementia. The other big category is called anticholinergic, and that's leading to dryness. And so you dry eyes, dry mouth. People with certain types of glaucoma should very much avoid that. There could be urinary retention along those lines. Then there's, you know, problems like with children where you can get the reverse effect. You can get agitation from that. And even in like an overdoses, kids can seize from that. And the combination of the antihistamine and the anticholinergic effects, because Benadryl can penetrate what's called the blood-brain barrier and get into that, it causes not only the sedation, but the combination can cause all kinds of hallucinogenic and other CNS problems. And that might have been highlighted if you heard of the TikTok Benadryl challenge, where kids died, and from that, the FDA even responded by putting a strong, firm warning on the label.
Okay, so what are the alternatives? Because as I said, for someone like me who is allergic to certain foods, and you take it and it is effective, and there's people with severe allergies who this has been helping, what is equally effective for someone to take in a situation like that? Or more effective, you're saying?
At least equally effective. And those would be what we call the non-sedating or second generation antihistamines. They don't have the anticholinergic effect. They common ones are like Allegra, which is fexofenadine, Claritin, which is loratadine, Zyrtec, which is cetirizine, and there are others. And so they are effective. There's no exact head-to-head comparison, but if you look at all the things, the side effects are greatly reduced. Their duration of action is 24 hours, as opposed to the shorter duration of Benadryl, which is around 6 to 8 hours. And obviously, it's shorter in kids and longer in adults from that. So, uh, there are very good, effective alternatives.
All right, well, definitely something for people to keep in mind and, of course, consult with their doctor before they change anything. Dr. Naclerio, thank you for joining us this morning.
My pleasure. And thank you for doing this segment. I think it's very good for, the people to be aware that some of the medicines that they can get over the counter could have serious effects. And I know you're on during the morning show, and people don't think of it, but when they did simulations of driving, that taking a Benadryl is actually affects your driving much more than taking alcohol from that. So,
Wow.
and people don't always know that. So it's good to bring these things to people's attention.
Definitely. All right, doctor, thank you so much.